Again, welcome to Principles of Epidemiology course. Again, this is our first lectures. In these lectures, we're going to cover the concept of epidemiology, the basic concept. So first, we're going to start with the definition of epidemiology. Then also we are going to define and generate a testable hypothesis. Also, we are going to describe the difference between descriptive and scientific or analytic epidemiologic studies. And also we're going to identify whether a particular study is a descriptive or analytical. Also, we are going to explain the role of descriptive studies for identifying problems and establishing hypotheses, including their use during disease outbreak. So most of the time, before we do any research in epidemiology field, we always start with the descriptive because the descriptive will give us the understanding of the phenomena, whether the risk factors or the exposure. Then from there, we start with the analytic. Analytic, we're trying to find the determinants, the cause of the outcome. So the relationship or the causal relationship. So let's start with our lectures. So first we start with the definition of epidemiology. And first here we said that epidemiology is based on two fundamental assumptions. The first assumption said human disease does not occur at random. There are factors or determinants which can increase or decrease the likelihood of disease. And I think this is the main reason why we study epidemiology. We want to know the causes or the factors, determinants of a disease or an outcome, the risk factors. So the second assumption tells us that the factors or determinants, some are causal and some are preventive, can be identified by systematic investigation of population or subgroups within population. This is the reason why in epidemiology field, we also have different type of research methods. Based on our problem or our objective, we may choose different type of research. Example can be a cohort studies or prevalence studies, which sometimes we call the cross-sectional studies. We also have a case control studies. This allows us to, again, to form a systematic investigation of a population or subgroup within a population. So epidemiology definition is the study of the distribution and also the determinants of disease frequency in the human populations and the application of these studies to control the health problems. So most of the time, epidemiologists is mostly involved on collecting data, analyzing the data, and trying to find a relationship between the risk factors and also the disease or the exposure and the disease. So again, the definition of epidemiology is the study of a distribution, the distribution of diseases or health problems, and also the factors or the determinants of the disease frequency in human populations and how to control it, the study to control the health problems. So the key word here again we start with is the human populations. Here we say the human population is the group of people with a common characteristics such as residence, age, gender, group membership, etc. And then the disease frequency is based on the counting the number of cases of a disease in a population over a specific time period. For example, sometimes we have a region or a neighborhood, a geographical area, and in this area, it's normal to have 2% of the population maybe to have a heart attack or some specific disease, which is normal for many years. Now, all of a sudden, we have 10% of the population have the disease. The next time we have 20, 30, then this might be some outbreak of a problem which is causing it. This is where epidemiologists come in. So how do we know the 10, 20% is what we call the cross-sectional studies to measure the prevalence. So again, counting the number of cases of disease in a population over a specific time period. This may determine whether we have an outbreak, is it a community health problem or individual. Again, epidemiology or public health deal with community health. So another keyword is the distribution in the definition. Here we say the distribution is how is the disease distributed throughout the population. Is it based on person, for example, the age, the sex, or the social economic status? SES stands for social economic status. Or if it's a place, is it a city, urban area within the US states or near incinerator? If it's a time, is it between June, July, summertime, winter, or decades, etc.? So again, the study of the distribution and also the determinants of a disease frequency in a human population and how to control it. So again, epidemiology deal with community health, not individuals. The next is the factors that cause some people to get a disease. So these factors that prevent some people from getting disease, we also call these exposures. And sometimes also we use the keyword risk factors. So the factors that either causes a disease or prevent a disease will be exposures. And also here we say there is no point to collecting and analyzing data if it cannot be used to help control the health problems. So that's why here we say the keyword and the application of this study to control the health problems. So the goal of epidemiology also collecting data, analyzing the data, find the exposures that is associated with the disease or the outcome. And now we need to find a way based on the analysis, the characteristics of the people who have the problem. We may come up with some recommendation that can lead us to control the health problems. So here we have some selected sub-discipline of epidemiologists. So epidemiologists mostly work in almost every field of studies. For example, in a factory industry, we may have epi for safety reasons. In environment, we may have environmental epi, again, to safeguard the environment, population, etc. So these are some few examples we have. In terms of disease, we may have cancer, cardiovascular, infectious, injury, psychiatric, reproductive. Exposure can be environmental, genetic, nutritional, occupational, which will be in industries, factories, pharmacologic, and social also. In terms of population, we can be clinical or geriatric or pregnant women or pediatric or veterans. That's the type of populations. So these are some of the questions that epidemiologists can help us to answer. So epidemiology helps answer questions such as, is the rate of drunk driving accidents increasing? So we may find association with that. Or what was the cause of hep outbreak? Who is most likely to get the flu? Do cell phones cause brain tumors? So we can see that most of all the questions we go through so far is based on data analysis. We're going to find a pattern in the data, in this case, in the subject attributes, the patients or the people attributes. So example, our cardiac rehabilitation program works well. Again, how can I answer this question? I will need data about cardiac rehabilitation programs, the participants, how far the condition become better or worse. Also, does vaccination cause seizures? Most likely I need the data to answer this question. Do certain genes put people at higher risk for diabetes, again, I need the data. So we can see that, again, epidemiology field is also based on data analysis, but this time we are going to analyze public health data. So the sequence of epidemiologic investigation. First, we suspect that exposure influenced disease occurrence. So we have a suspicion that there's a relationship between some exposures or risk factors and a specific disease. Now, based on the number of population or people who have the problem, maybe it passes the threshold, the default value, which is we consider as normal. Let's say if we have a specific disease in a specific region for the past 10, 20 years, it's around 5% of the population. All of a sudden, it's go to 20, 30, then we may surely have an outbreak. So our goal will be, we have a suspicion now. So we have to do a study now to find if there's any exposure influence that disease occurrence. So this will lead us to form a specific hypothesis about the exposure disease association. Then if we have the hypothesis, now we can conduct epidemiologic studies to measure the relationship between the exposure and the disease. Next, we're going to judge whether the association is valid and also causal. So what we mean is that sometimes we may have association between or relationship between two variables, the risk factors and the outcome, but that may not be the causer. Maybe there's a confounding variable or maybe some modification effect, etc. So here we need to accumulate evidence, and there may be some chances, randomness or bias and confoundings. So after we get our solution, the next step, we need to evaluate our prevention and treatment. If we have, again, identified the exposure as the exposure and the causal, in this case, it will be a causal relationship between exposure and the disease. If we are be able to establish it and we are right, then we move to how we can prevent the problem or treatment. So that again, so this is the sequence of epidemiologic investigations. Always there must be a suspicion of some exposure and outcome. There's an outbreak. We generate our hypothesis, then we conduct our epidemiologic studies. We need to design our study, choose the type of studies we are going to do. We need to collect our data, do our data analysis. Then we see if there's any relationship, a causal relationship. Now we should be very careful with at least the confounding variable. If we can establish the relationship, the causal, then we move to the process of going through the preventions and the treatment. So next we say, what is a hypothesis? A hypothesis is a testable statement that tries to explain a set of observations and can be rejected or not rejected through scientific research. So a hypothesis is more or less like a question, but it's a statement. And normally we have two types of hypotheses, the null hypothesis and also the alternative hypothesis. So we have two criteria for good hypothesis. Hypotheses are statements that project the expected association between two or more measurable variables. Also, hypotheses carry clear implication for testing stated relations. So normally the null hypothesis will be our claim. There was a claim that in 1970, US adults are obese. Now we want to check in 2021 if that claim is still valid. So in this case, my null hypothesis will be US citizens are obese. Alternative will be either they are not obese, which will be a two-way testing, or if we quantify the value for obese, we may say the value is greater or less than. So hypotheses are very important for advancing epidemiologic research. Also, it will guide us for our study design to select the right studies and designing. And also variable selection, sample selection, data analysis, and interpretation of results. So an example of an hypothesis here is cigarette smoking causes lung cancer. So this may be a claim that we have, and that will be the null hypothesis. Then I may say cigarette smoking does not cause lung cancer. So that would be my alternative hypothesis. So the operational hypothesis, this is the one you want. People who smoke cigarettes have a higher incidence of lung cancer over a 10-year period than people who do not smoke. So we can see that this is more specific. So this would be our hypothesis. Cigarette smoking causes lung cancer. And here we can quantify also how many cigarettes. So maybe smoke more than one pack a day causes lung cancer. 10% chance or 100% chance or 50% chance of causing a lung cancer. So this is a claim that we know. Previous studies, we have that result. So the hypothesis of this study is on cigarette smoking and lung cancer. And then providing care to persons with dementia is stressful, which leads to physical health decline. Again, this is another example here. The best way we can say it is caregivers to relatives with dementia will have a higher incidence of high blood pressure than non-caregivers, mediated through higher levels of stress-related symptoms. So not caregivers to relatives with dementia will have a high blood pressure. But we can see the two here also again almost means the same, but how we word it, this is more specific and more direct. So because here we say providing care to persons with high dementia is stressful, which leads to physical health decline. But here we say caregivers to relatives with dementia will have a higher incidence of high blood pressure, so more specific than non-caregivers, which is mediated through higher level of stress-related symptoms. So we have two types of epidemiology. We have descriptive and also analytical or scientific epidemiology. Now, descriptive is more or less like descriptive statistics. We try to understand the phenomena. Descriptive statistics, we try to understand the values or the data set we have. So this will describe the disease patterns. To monitor the public health, to evaluate success of intervention programs, or to generate hypotheses about causes of disease. And this can lead us to identify and count cases of disease in population and also conduct simple studies. So from descriptive epidemiology, we can generate our hypotheses, and that can lead us to choose what type of studies we want to use. Example, case report, case series, cross-sectional study, ecologic study. Again, we may go through all these studies in the near future lectures. The key word again here is analytic. So analytic epidemiology is we are doing analysis to find a relationship between the risk factors or the exposure and the outcome. So here we are searching for disease causes and preventions. Here we are going to evaluate hypotheses about causes of disease, and also we are going to evaluate success of intervention programs. So here we're going to compare the groups and systematically determine, is there an association? Clinical trial can be a good example. A clinical trial is experimental studies, and it automatically eliminates the confounding variable. That's one of the advantages of experimental studies. So here we can easily identify the causes and effects, the relationships causal relationship. Also experimental study, case control studies, and cohort study. Case control and cohort also we can use it to find relationship, but it's an observational study. So sources of epidemiologic investigation, as we went through these slides before, we can say at the top we have the descriptive. So descriptive will be there's a suspicion of exposure and an outcome, but we are not going to find no relationship between them, nothing. But here, the goal of a descriptive here will be forming hypotheses about the exposure and the disease association. Then in the analytic phase is where we are going to conduct our study to measure the relationship between exposure and disease. So the first two steps here is descriptive, and the last three at the bottom is analytic or scientific. So let's take a closer look at descriptive epidemiology. In later lectures, we go into the future lectures, we are going to study about analytic epidemiology. So with descriptive epidemiology, the first question is, what are the main diseases in the population? What kind of disease in the population? And now, who is getting the disease? And how does it vary across place and time? So we have the main uses, and here will be identify the problems, the trends, and high-risk groups. Also the public health planning, where to spend resources, and generate hypotheses for analytical epidemiology. These will be some of the examples of descriptive epidemiology. The limitation here again, we cannot identify the cause of disease. Why, how will be epidemiology for scientific or analytic epidemiology. So with descriptive, who, where, the time, then analytic or scientific will be how or why, etc. So a closer look at the descriptive studies here, we say the person. Is it go by the age, the race? Example here we have race and ethnicity, percentage of the disease, mortality rate, by education or other factors within a person. Then next will be the place, location, Japanese in Japan or Japanese immigrants in California. There was a study done about mortality rate due to stomach cancer by region. The Japanese in Japan, we have 58. By Japanese immigrants to California is 30. And the sons of Japanese immigrants is 12. California residents, non-Japanese is 8. So this is based again on the region. We can also have the time when it occurs. So here we have some sleeping time, 0 to 3 hours, 3 to 4 hours, etc. Now we also have outbreaks. Is this an outbreak? As we said earlier, outbreaks will be the percentage or the prevalence is above the normal prevalence, or the percentage of people having the problem is normally above the normal percentage. So example here, we have 3,389 cases of West Nile virus infection in 2015 in the United States, compared with 149 cases from 2013 to 2014. So within 2 years, we have only 149, but in a year we have, so this can be an outbreak. The number is too much. Or another example, we have 2,820 cases of TB in 2015 in Guatemala. Now we can compare this with 3,059 cases in 2014. When we look at 2014 was 3,059 and 2015 was 2,820, we can see there's no much difference. So here we can say there's no outbreak for the second. But the first one, from 149 to 3389, even twice of it, because it's 2 years, the difference is very big. So we may have outbreak on the first, but the second there's no outbreak. So we say the first one, yes, there's outbreak, but the second, no, because the values are very close. Now, where can we get data? For as an epidemiologist, or again, you are more or less a data analyst. Most of the data we use in epidemiology, again, is data related to diseases, public health data. So who can get? Governments have it, NGOs, MOs, hospitals, very good place, and independent researchers also. Then what type of data? We can use the US Census or health surveys, death certificates or birth certificate, cancer registries, this can be in the hospital, or hospital discharge registries, infectious disease report. So this would be, again, sources of epidemiologic data. Again, these are just a few places we mention here, but again, it can be so many sources. We also have a secondary data like online in different government agency websites, such as Center for Disease Control, CDC, have a lot of public health data. Even National Health of Institute have a lot of public health data also, or medical data. So the source of epidemiology data, the strength is always exist. We also have to establish methodology. And this data may be available for no or little cost, especially in the government agencies, it's almost free. There's no cost. Now, the weakness of these data, these are secondary data, so maybe the accuracy will be a problem, may have inaccurate information, or may not include the data you want, or likely reporting delays, also may involve complicated methodology. Here we are talking about the source of secondary data. Primary data is the data that the researcher will generate in the field. An example, there is an outbreak in a neighborhood, a geographical area. I will go there and collect the data firsthand. So this is a primary data. But here we are talking about data that has been used or stored in a hospital or in a database system, government agencies, etc. So these are called the secondary data. In our future lectures, we're going to discuss about the difference between primary and also secondary data. So this will be the conclusion of our lectures. Again, these lectures cover the basic concept of epidemiology, especially the definitions and some the factors. And also our next lectures, we are going to go more detail on the topic. So again, wish everybody the best and thank you.